Hi, my name is Dr. Justin McCormick, and I'm the Clinic Director of the Spinal Decompression Center in Mill Creek. You're probably watching this video right now because you're frustrated about your chronic back or your neck pain that just won't go away. Or maybe you're frustrated because all these medications that you're on, your doctors are giving you, or the injections that you're getting that just aren't working anymore. Or maybe you're frustrated because you've been told that you just have to learn to live with the pain. I know some people right now are watching because they've just been told they have this new condition or this new diagnosis in their back that they're not familiar with, and they're looking for who's the best doctor to treat this problem. Well, whatever the reason is you're watching this, if you're suffering from a slipped, herniated, or bulging discs or spinal stenosis, then this video is for you. I've treated thousands of patients with herniated discs and spinal stenosis, and we get fantastic results. I see people who can barely function, who can't work, who can't go to social events with their friends, who can barely walk because their pain is so bad, who now they're living a normal life again. I see people who can't sleep through the night because they just can't find a comfortable position. I see people who have so much numbness in their legs or in their hands that they just can't even feel anything anymore. Or maybe they're losing muscle strength because of all the nerve damage that's going on. So if you're suffering from the conditions that I just talked about, or maybe similar painful conditions, spinal decompression may be able to help you to get your life back again. So there's a few things that I want to go through in this short video. One is I want to explain what a disc problem is and how does spinal stenosis develop. So I'm going to use these models here. So this, first of all, is a normal disc. These are bones. Between the bones is what's called the disc. Now this is a normal sized disc, and if we look in the center of it, you'll see there's two parts. The middle is called the nucleus. That's the soft jelly portion. And the outer rings are called annular fibers. So essentially we're looking at like a jelly donut. We want to make sure that the jelly stays inside of the donut. We don't want that to pop out and hit on either the spinal cord or go out through these openings and hit onto that nerve. So again, that's normal. This is called a bulging disc. Now a bulging disc, you can see it's much less space between the two vertebrae, and that's because that inner fluid is starting to leak out. It's what we call bulging. Now you can see in this example, it's not bad enough yet to where that fluid has hit that nerve. So this person will probably have a lot of back pain, but they're not going to have very much radicular or radiating symptoms. This is an advanced disc problem. This is called a disc protrusion or a disc extrusion, depending on the severity. But here you can see how that fluid, the jelly that we talked about, is actually pushing out of the capsule and is now hitting on that nerve. So this person's going to have a much more intense pain, and the pain's probably going to radiate down that nerve. So it may go into the legs if it's a lower back herniation, or it'll go into the arms if it's a neck herniation. The final phase that we have is called disc fusion. This is the bone-on-bone cases, very difficult to treat because we don't have any disc there. We essentially have a bone sitting on the nerve. It's a very difficult case to treat, so we want to make sure that you haven't got to that point yet. Most patients who have these type of problems have been on many different treatments. They may be on drug therapy like Oxycontin or oxycodone, maybe Vicodin, and all these are designed to do is patch the pain. What do you do if that doesn't work? People will have what's called epidurals, where they have an injection into their back that's again just designed to numb the pain, but it doesn't do anything to correct the problem. What we specialize in is called spinal decompression, and we use technology called the DRX9000. It's a breakthrough technology designed to correct herniated discs and spinal stenosis. So how decompression works is, when we find the herniated disc, we put decompressive forces into it that pumps that disc. And what it does is it pulls oxygen, water, and nutrients back inside of the disc, pulls that fluid away from the nerves back to where it's supposed to be, and the pain is either alleviated or it's dramatically reduced. We also have other therapies that we do in conjunction with decompression. We'll do what's called laser therapy. Lasers are an amazing technology designed to decrease inflammation in the back and increase the rate of healing. So you're going to heal a lot faster and have less pain much quicker. We'll also use what's called a distractor brace. It's a brace that goes around the lower back, designed to pull apart the damaged discs so that you can heal in between treatments. So you're not going backwards when you're not undergoing the treatment. We'll also use supplementation, designed to speed up the rate of recovery while you're under decompression. So those are some of the things that I wanted to go through with you in this video on disc problems, on how we correct it, and what some of your alternatives are. Now below this screen, you're going to see several different patient testimonials. I really encourage you to look at those. Read people's stories. Watch the videos that I've put on there. You're going to see what normal everyday patients that we see in our office are, how their recovery is, and how they were when they came into the office. So I encourage you, if you want to get this back or neck problem corrected, call our office and ask for a free consultation. They'll set you up to meet with me, and we can go over your condition one-on-one, and I can let you know if you're a candidate for spinal decompression. I look forward to your call, and I hope to hear from you soon.